Good evening, my fellow nursing colleagues. Tonight, I would like to speak with you about music therapy and stroke rehabilitation. Now, we all know that a stroke is a brain attack, meaning that it occurs in the same way that a heart attack does, only it affects the brain instead of the heart. Now, a stroke occurs when the blood supply to part of the brain is suddenly cut off. This can happen when either a blood clot blocks a blood vessel or when a blood vessel breaks and spills blood into the brain. As a result, brain cells in the affected area die. Now, there are two main types of stroke, ischemic and hemorrhagic. Now, with an ischemic stroke, blood supply to part of the brain is cut off because a blood clot has blocked the blood vessel. Blood clots can travel to the brain from another artery or they can come from the heart. Hemorrhagic strokes result from a weakened blood vessel that ruptures and bleeds into the surrounding brain. This blood spills in around the brain and creates swelling and pressure, damaging cells and tissues in the brain. Transient ischemic attack. TIAs are also called mini strokes. Transient ischemic attacks are caused when blood flow to parts of the brain are restricted for brief periods of time. Because the blood supply is restored quickly, brain tissue does not die as it does in a regular stroke. These attacks are often early warning signs of a stroke. The only difference between a stroke and a TIA is that with a TIA, the blockage is temporary. Around 610,000 people in the United States report having a new stroke each year. 1 out of 4 of the 800,000 strokes each year is a recurrent one. Strokes happen in 7 to 15 out of every 100 strokes, or 100,000 people for those under the age of 45. African Americans have almost double the risk for having a stroke. About 795,000 Americans each year suffer from a new or recurrent stroke. On average, a stroke occurs every 40 seconds. This shows that the leading correctable ailment and leading ailment is stroke. Now, risk factors of stroke that are modifiable include high blood pressure, tobacco use, diabetes, high blood cholesterol, physical inactivity, and obesity, poor diet, carotid, or any other artery diseases. Now, uncontrollable risk factors include increasing age, gender, hereditary, and race prior stroke. Now, signs and symptoms of stroke, we all know, have to do with numbness, confusion, trouble seeing, trouble walking, severe headache. Now, if you see any of these symptoms, like the sudden numbness or weakness in the face, arm, or leg, especially one side, or sudden confusion from the patient, trouble speaking or difficulty understanding speech, sudden trouble seeing in one or both eyes, sudden trouble walking, dizziness, loss of balance or lack of coordination, sudden severe headache with no known cause. These are signs and symptoms you need to look for. Now, if you think someone might be having a stroke, say you're out eating dinner with someone, and someone shows these signs, call 911. Now, the acronym to help you remember this is FAST. F for face drooping, A for arm weakness, S for speech difficulty, and T for time to call 911. So when someone is showing signs of facial drooping, does one side of the face droop or is it numb? Ask that person to smile. Arm weakness, is one arm weak or numb? Ask the person to raise both arms. Does one arm drift downward? Speech difficulty, is the speech slurred? Can they repeat back to you a simple sentence like the sky is blue? And if the sentence is repeated correctly or incorrectly, you'll have a good idea of whether they might be having a stroke. Now, if any of these signs show, call 911 and get the person to the hospital immediately and monitor what time it started so that you can tell the doctor so that they can give the best care. Now, locations of interest where music therapy can be utilized. Some of those areas are the neurology unit, the rehabilitation unit, the neurology intensive care unit, and even at home. Now, nursing areas where music therapy can be of assistance are movement and muscle control, speech and communication, cognition, mood, and motivation. Now, music therapy has been medically and scientifically proven to be an effective tool in rehabilitation after stroke, particularly in these areas. Music and muscle control interventions. Now, because there's a strong connection between what we hear and movement, say dancing without music, and because music is an organized, predictable stimulus, it's effective at improving motor deficits caused by stroke. A survivor can have a regular gait by walking to the beat of a familiar song and playing instruments such as drums, piano, or triangle. This can encourage movement and improve strength and coordination in an affected arm. If the patient is working on walking because their gait is uneven or they shuffle their steps, provide a strong, steady beat, usually played on a drum. Those drums can help increase the range of motion in your arm. It can help when you're exercising to the upbeat of a music. It helps retrain the steps of the patient by playing that music. You could also have them sing a familiar song like the Battle Hymn of the Republic with a strong beat for motivation. And often the person will not only be walking with even steps, they may also be singing along. Now, one of the earliest systematic applications of music to recovery of speech function was developed in the early 1970s by using singing with patients who suffered from expressive aphasia. Now, because singing and speaking use several similar processes such as respiration, making speech-like sounds, and articulation, singing may improve speaking skills for some. Many times a person with aphasia may not be able to speak, but they can sing. This is because speech is processed and produced primarily in the left side of the brain. On the other hand, music is processed and produced in multiple parts of the brain. Some of these can overlap with speech centers and some do not. Now, a therapist can stimulate and strengthen injured speech centers or create new connections around injured areas to potentially help people speak again. Now, therapists can use the rhythm, melody, and singing, like I said, to improve communication with stroke patients. It helps exercise the muscles of the mouth, setting those phrases to music, singing the words, transferring these words to speech, helps them get back that loss of function that they had. Rhyming, chanting, rapping are also tools. Now, music and musical structures are used to enhance the aspects of cognition, including attention, memory, organization, and problem solving. The goal of cognitive rehabilitation is to help patients with cognitive deficits to adapt to their disability and improve overall functioning. Now, some of these interventions can be creating a song with lyrics that contain important information that is important to the patient that they need to retain. Conducting or performing in a band, say as a conductor, or performing an instrument, drum, piano, guitar, or rhythm with repetition games. Mood, motivation, and pain management. Motivation and pain management activities include songwriting, recording, improvisation, performance, music listening. Playing an instrument uses many aspects of the brain and body and can even be fun for the patient. Now, music therapy can also be used at home. Now, personalized therapy for the patients can include music for exercise, music for relaxation to help them be calm, music for pain management to help get them to distract them from their pain, music to sing along with to help them with their speech, and direct recording of the patient's personal music therapy sessions can also be an assist for when they're at home, so that if they forget anything that they were told during their session, they have it to fall back on a recording to help them at home so that they can utilize it to their optimum level. Thank you for listening, and I hope you have a wonderful day. Please follow the survey at the end.